My name is Peter Cassell, Cassell. I'm a spokesperson for the Department of Health and Human Services. I'm assigned here as your public information officer. I'm trying to find my last button.
Could you give us an idea of what occurred from Wuhan to here? What transpired over the last 15 hours?
Hang on 1 second. So what's going on behind me? About 57 passengers are getting off this plane, and they're going to be going through screening. CDC set up in the hangar over here. They're going to make sure that these passengers are healthy and safe. They've been traveling for a very long time from Wuhan. I'll go ahead and take your questions. I'm not a medical doctor, so I don't want to get into any details about that. We're really just going to talk about what's going on here. I also won't get into the sort of national response that's going on. So we can
so
go
we were
ahead
told
and
the initial number was supposed to be 70, and you just said 57 now.
There's some slight reshuffling of the passengers from the availability of the other bases. So the ultimate and manifest is 57 here.
Can you describe it all, who these people are, why they were in China?
I can't, no.
What will happen inside the building over here?
The passengers will be screened for any symptoms. If they have a fever, if they need additional screening, they'll be seen by more personnel, and if there's any reason or risk, they will be moved to UNMC Medical Center.
Can you give us any explanation as to what happened between Wuhan and here? What stops they made along the way?
This plane itself has been to 2 additional stops before here. It stopped at Travis Air Force Base in California, as well as Lackland Air Force Base in Texas. The passengers who are leaving this plane have been screened several times before they got here. This will be their 3rd screening, and then they'll be quarantined at Camp Ashland for the next 14 days.
Do you have an idea of how many children are...
There are about 10 children.
Okay, do you know the age range by chance?
I don't, off the top of my head, no.
Can you tell us more about it, Peter? We just know there's U.S. government workers who do now have more, waiting for the manifest, more ages and what they did there.
I'm not sure if they're all government workers. I'll have more information for you probably over the next couple hours.
Did this plane drop off passengers in both the previous bases?
It did, and that's why the ultimate manifest is 57.
So some on in each city?
Yes.
Was anyone showing symptoms, as far as you know, along the way?
I can't comment on that.
Do you have any idea how long the screening process will take here?
The screening process is estimated to take about 1 to 2 hours. So this whole process that you're seeing back here, the buses will move over into the hangar. They'll be screened, and then they'll get back on the buses, and the buses will go straight to their quarters for them to rest.
Was anyone taken to UNMC?
Not as of right now, no.
The shuffling that was done at the previous bases, was that 100% based on the space available at the other places, or was there some medical?
As far as I know, yeah. I can't comment any further on that.
How many total have rescued Americans besides this plane? How many total are we talking about?
I'll have to get that to you later. I don't have it here.
Pete, I don't know how much you can talk about this, but is there any info, and forgive me if you already talked about it, about how they were on all these passengers were, all these last hours on this flight?
I don't have any details on how they were for this flight. The passengers who have come here again have been screened 2 times before this, so we'll know more as they go through screening here.
Can you talk about their mood at all on the plane? Are they talking to each other or anything?
I don't have any information on that. I don't have a direct line into the plane. Sorry.
Through the camera, we see biohazard suits, we see medical personnel. Are the passengers themselves? Can you tell us what kind of protective gear they're wearing as they plane?
They should be wearing the appropriate personal protective gear. That would include face masks for them. Depending on any symptoms they might have.
There's a lot of baggage that came off too. What happens with that?
They'll ultimately claim their baggage when they get to Ashland.
Will the pilot and airline and personnel on this plane also be screened and kept?
Yes, they will. Yeah. with everyone at Ashland. Yep. It's standard procedure for this kind of operation. And again, this is all out of an abundance of caution, so we want to make sure that not only the passengers are safe, the pilot and the crew are safe, and then ultimately the American people are safe.
And again, how many are going for screening now versus how many total are flights?
I don't know how many people are part of the crew, so I'd have to get back to you on that.
But passengers-wise,
Passengers is 57.
and all of them are going for screening?
All of them will be going through screening, yes. Brian? I'll have to get back to you.
You expect all 57 of those to be in Camp Ashland within a couple hours?
Yes. Yeah. I haven't interacted with any of the passengers myself, so I wouldn't be able to comment on their mood. I know after a long journey, I feel I would want to rest, and ultimately they'll get to rest as soon as they get to Camp Ashland.